Everything you need to know about vaginal discharge. Hi, welcome to Health Place. In this video, you will get to know everything about vaginal discharge. So, keep watching and don't forget to hit the subscribe button and enable the notification bell. Vaginal discharge is most of the time a typical and expected event. Certain forms of discharge, however, might suggest an illness. The abnormal discharge might be yellow or green in color, chunky in texture, or unpleasant smelling. Typically, abnormal discharge is caused by yeast or bacterial infection. If you observe any odd discharge or smell, consult your doctor for a diagnosis and treatment. There are several forms of vaginal discharge. These kinds are classified according to their hue and consistency. Certain forms of discharge are common. Others may point to an underlying disease that needs treatment. Types of vaginal discharge. 1. White. A little white discharge is typical, especially at the start or conclusion of your menstrual period. However, if the discharge is itchy and has a thick, cottage cheese-like substance or texture, it is not normal and requires treatment. This sort of discharge might indicate a yeast infection. 2. Clear and watery. It is entirely normal to have a clear and watery discharge. It can happen at any moment during the month. It may be particularly heavy following exercise. 3. Clear and stretchy. When your discharge is clear but stretchy and mucus-like rather than watery, it means you're ovulating. This is a rather common form of discharge. 4. Brown or bloody. Brown or red discharge is common, especially if it happens during or immediately after your menstrual period. A late discharge at the end of your period might seem brown rather than red. Between periods, you may sometimes notice a little quantity of bloody discharge. This is known as spotting. If you have spotting during your period and have just had sex without protection, this might be an indication of pregnancy. Spotting during the early stages of pregnancy can be a symptom of miscarriage, so talk to your obstetrician-gynecologist about it. Brown or bloody discharge might be a symptom of endometrial or cervical cancer in rare situations. Other issues, such as fibroids or other abnormal growths, might be the cause. This is why an annual pelvic check and pap smear are so crucial. During these procedures, your gynecologist will look for cervical anomalies. 5. Yellow or green. A yellow or green discharge is abnormal, especially if it is thick, chunky, or accompanied by an unpleasant odor. This sort of discharge might be a symptom of Trichomoniasis illness. Sexual contact is a typical way for it to spread. Causes of vaginal discharge. 1. Bacterial vaginosis. Bacterial vaginosis is a very frequent kind of bacterial infection. It causes increased vaginal discharge with a strong, unpleasant, and occasionally fishy odor. However, there are no symptoms in other cases. Women who have oral sex or have numerous sexual partners are at a higher risk of contracting this illness. 2. Trichomoniasis. Another form of infection is trichomoniasis. A protozoan, or single-celled creature, causes it. The illness is typically transmitted through sexual contact, but it can also be caught through the sharing of towels or bathing suits. It produces a foul-smelling yellow or green discharge. Pain, inflammation, and itching are other typical symptoms, however, some patients may not have any. 3. Yeast infection. A yeast infection is a fungal disease that, in addition to the burning feelings and itchy feelings, generates a white, cheese-like discharge. The presence of yeast in the vagina is normal, but its development can become uncontrollable under certain circumstances. 4. Gonorrhea and chlamydia. Gonorrhea and chlamydia may lead to abnormal discharge by sexually transmitted diseases, STIs. The hue is frequently yellow, greenish or hazy. 5. Pelvic inflammatory disease. Pelvic inflammatory disease, PID, is an illness that is frequently transmitted through sexual intercourse. It happens when germs travel up the vaginal wall and into the reproductive organs. It may emit a foul-smelling, thick discharge. 6. Human papillomavirus, HPV, or cervical cancer. HPV infection is transferred via sexual contact and can lead to cervical cancer. This kind of cancer can cause a red, dark, or watery discharge with an unpleasant odor, even if there are no symptoms. With regular Pap screenings and HPV testing, cervical cancer can be easily detected. Home care for vaginal discharge. Practice proper hygiene and use airy cotton underwear to prevent infections. Don't douche, because eliminating beneficial bacteria might make discharge worse. In addition, practice safe sex to prevent STIs. Eat yogurt, including live and active cultures, to reduce the probability of yeast infection by using antibiotic drugs. You may also treat it with the on-the-go yeast infection or with the suppository if you know you've had a yeast infection. When to seek medical help. In case you have any worries about the usual discharge, visit your doctor.